CEN Exam Prep Description. Question 1. A patient is bitten by a venomous snake. What is the priority nursing action? Option A. Apply a tourniquet above the bite. Option B. Immobilize the affected limb. Option C. Administer antivenom immediately. Option D. Incise and suction the wound. The correct answer is option B. Immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Question 2. A patient with a wrist sprain is being discharged. Which instruction is most appropriate? Option A. Apply heat for the first 24 hours. Option B. Apply ice for the first 24-48 hours. Option C. Begin range of motion exercises immediately. Option D. Avoid immobilization to prevent stiffness. The correct answer is option B. Apply ice for the first 24-48 hours. For acute sprains, rest, ice, compression, elevation is recommended. Ice should be applied for the first 24-48 hours to reduce swelling. Heat, A, is applied after 48 hours for muscle relaxation. Immediate range of motion, C, can worsen injury. Immobilization, D, is needed initially for healing. Question 3. An epidural hematoma is most commonly associated with which mechanism of injury? Option A. Striking the head on a hard surface. Option B. Rapid deceleration injury. Option C. Injury to the temporal bone with laceration of the middle meningeal artery. Option D. Acceleration minus deceleration injury causing shearing forces. The correct answer is option C. Injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which nursing intervention is most important for a patient with an ENG tube to low intermittent suction? Option A. Change the ENG tube every 24 hours. Option B. Provide frequent mouth care. Option C. Maintain the patient in a supine position. Option D. Flush the tube every 8 hours with 50 ml of sterile water. The correct answer is option B. Provide frequent mouth care. ENG tube to suction can cause a dry mouth and sore throat. Frequent mouth care, including oral hygiene and moisturizing lips, is essential. The tube does not need to be changed daily. A. Supine position, C, increases risk of aspiration. Flushing, D, depends on hospital policy and should not use large volumes. Question 5. A patient in atrial fibrillation with rapid ventricular response has a heart rate of 152 bpm and is hypotensive. Which intervention should the nurse anticipate? Option A. Administration of 4-diltiazem. Option B. Administration of 4-amiodarone. Option C. Synchronized cardioversion. Option D. Administration of 4-digoxin. The correct answer is option C. Synchronized cardioversion. In unstable atrial fibrillation with rapid ventricular response causing hypotension, synchronized cardioversion is the immediate treatment of choice. Hemodynamic instability indicates the patient cannot tolerate the rapid rate and requires immediate electrical conversion. Chemical rate control with diltiazem, A, amiodarone, B, or digoxin, D, is appropriate for stable patients but is too slow for unstable patients. Question 6. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A. Return to the waiting room in line of sight of the triage nurse. Option B, resuscitation bay to prepare for intubation. Option C, isolation room on droplet precautions. Option D, isolation room on airborne precautions. The correct answer is option D, isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Question 7. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B, ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 8. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient presents with cough-ground emesis and melena. What is the priority nursing action? Option A, administer 4 fluids. Option B, insert a nasogastric tube. Option C, prepare for blood transfusion. Option D, assess airway and breathing. The correct answer is option D, assess airway and breathing. The ABCs take priority. Cough-ground emesis and melena indicate an upper GI bleed. The patient is at risk for aspiration and hypovolemic shock. Airway assessment and breathing are the first steps. 4 fluids, A, blood transfusion, C, and tube insertion, B, are important but secondary to airway assessment. Question 10. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A, systemic lupus erythematosus. Option B, rheumatoid arthritis. Option C, scleroderma. Option D, Sjogren's syndrome. The correct answer is option A, systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth. Question 11. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A, administer 4 fluids. Option B, obtain a urine pregnancy test. Option C, prepare for immediate surgery. Option D, assess for signs of hypovolemic shock. The correct answer is option D, assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra-abdominal bleeding. Assessment of vital signs and signs of shock are the priority. 4 fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 12. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A, inability to abduct the fingers. Option B, inability to oppose the thumb. Option C, inability to adduct the thumb. Option D, decreased sensation in the small finger. The correct answer is option B, inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 13. A patient is experiencing acute panic attack. Which of the following is the most appropriate nursing intervention? Option A, administer lorazepam immediately. Option B, provide reassurance and remain calm. Option C, place the patient in seclusion. Option D, encourage deep breathing and mindfulness. The correct answer is option B, provide reassurance and remain calm. A calm, reassuring presence is the first line intervention for a panic attack. Remaining with the patient and speaking in a calm, quiet voice can help to escalate the situation. While lorazepam, A, may be used for severe cases, it is not first line. Seclusion, C, may increase anxiety. Deep breathing, D, is helpful but the nurse's calm presence is the initial priority. Question 14. A patient presents with acute pelvic pain, fever, and cervical motion tenderness, chandelier sign. What is the most likely diagnosis? Option A, ectopic pregnancy. Option B, ovarian torsion. Option C, pelvic inflammatory disease. Option D, appendicitis. The correct answer is option C, pelvic inflammatory disease. The classic triad of PID is pelvic pain, fever, and cervical motion tenderness, chandelier sign on bimanual exam. Ectopic pregnancy, A, would present with pain and bleeding but often no fever. Ovarian torsion, B, presents with sudden, severe unilateral pain without cervical tenderness. Appendicitis, D, presents with right lower quadrant pain. Question 15. A patient is receiving packed red blood cells. 15 minutes into the transfusion, the patient reports chills, flank pain, and shortness of breath. What is the nurse's priority action? Option A, slow the infusion rate. Option B, stop the transfusion immediately. Option C, administer diphenhydramine. Option D, notify the provider. The correct answer is option B, stop the transfusion immediately. This patient is experiencing signs of a possible transfusion reaction, chills, flank pain, dyspnea. The immediate priority is to stop the transfusion, keep the 4-line open with normal saline, and notify the provider. Slowing the infusion, A, does not stop the reaction. Diphenhydramine, C, may be given but after stopping the transfusion. Question 16. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Question 17. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A, perform a 12-lead ECG. Option B, obtain vital signs. Option C, administer aspirin. Option D, assess the chest pain. The correct answer is option B, Obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Question 18. A patient is diagnosed with a UTI and prescribed nitrofurantoin. What is an important patient education point? Option A. Take the medication with milk. Option B. Complete the entire course of antibiotics. Option C. The medication may turn the urine bright orange. Option D. Avoid foods high in tyramine. The correct answer is option B. Complete the entire course of antibiotics. Completing the entire course of antibiotics is essential to prevent recurrence and antibiotic resistance. Nitrofurantoin should be taken with food, not milk. A. It may cause brown or rust-colored urine, not bright orange. C. Tyramine avoidance, D, is important for MAOI medications. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A. Sudden, severe thunderclap headache. Option B. Gradual onset of confusion. Option C. Focal weakness on one side. Option D. Loss of consciousness without headache. The correct answer is option A. Sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 20. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A. Apply fresh water to the area. Option B. Apply vinegar to inactivate nematocysts. Option C. Apply heat to the area. Option D. Rinse with seawater and apply ice. The correct answer is option B. Apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred. Question 21. Which of the following is the earliest sign of cardiac tamponade? Option A. Muffled heart sounds. Option B. JVD. Option C. Pulsus paradocus. Option D. Hypotension. The correct answer is option A. Muffled heart sounds. The classic Beck's triad includes muffled heart sounds, JVD, and hypotension. Muffled heart sounds are often the earliest sign because fluid accumulating in the pericardial space dampens the audible heart sounds. JVD, B, occurs as right heart filling is impaired. Pulsus paradocus, C, is a later finding. Hypotension, D, is a late sign indicating severe hemodynamic compromise. Question 22. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A. Palliative care begins with the initial diagnosis and continues through the end of life. Option B. The patient cannot change their end-life decisions once enrolled in hospice. Option C. There is an important legal distinction between withholding care and withdrawing care. Option D. A living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker. Question 23. The possibility of an ectopic pregnancy increases when a patient has a history of Option A, breast cancer. Option B, endometriosis. Option C, teenage pregnancy. Option D, pelvic inflammatory disease. The correct answer is option D, pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors. Question 24. A patient presents with signs of hypothermia. Which core temperature indicates severe hypothermia? Option A, 32 degrees Celsius. Option B, 30 degrees Celsius. Option C, 28 degrees Celsius. Option D, 26 degrees Celsius. The correct answer is option C, 28 degrees Celsius. Severe hypothermia is defined as a core temperature below 28 degrees Celsius, 82.4 degrees Fahrenheit. At this temperature, the patient may be unconscious with minimal or absent vital signs. Mild hypothermia, 32-35 degrees Celsius, A, moderate, 28-32 degrees Celsius, B, and severe, 28 degrees Celsius, C. Option D, 26 degrees Celsius, is also severe, but 28 degrees Celsius is the threshold. Question 25. A patient presents with nuptial rigidity, photophobia, and altered mental status. What is the priority diagnostic test? Option A, CT scan of the head. Option B, lumbar puncture. Option C, MRI of the brain. Option D, the blood cultures. The correct answer is option A, CT scan of the head. While lumbar puncture, B, is diagnostic for meningitis, a CT scan of the head must be performed first to rule out increased intracranial pressure, which would make lumbar puncture dangerous. Blood cultures, D, should be obtained but after CT, MRI, C, is not the initial test.